Good evening. I'm Kayla McKinney, Director of Health Services for Meridian School District. I'll be going over the 2017-2018 Board of Education report. Last year, we added emergency EpiPens at each building. These are on hand in case someone experiences an allergic reaction to an unknown allergen, or if someone experiences a reaction to a known allergen, but they do not have an EpiPen on hand at school for one reason or another. In accordance with school code, we have standing orders from a physician on file that outline the appropriate use of the EpiPens. We'd like to thank Dr. Flynn for providing these orders and making it possible for us to have them at school. Thankfully, we have not yet had to use one of the EpiPens, but it is very reassuring knowing that we have another added safety measure for our students. Over the summer, we utilized the Ronald McDonald Care Mobile to provide physicals and immunizations to students. Since our students are required to have physicals and immunizations at certain grade levels, we were excited to help facilitate this service so that there is a better chance that they will stay in compliance and be able to stay in school. It would be ideal to have a permanent service on site for students to receive not only physicals and immunizations, but also routine care for things like chronic conditions and sick visits. This led us to explore the idea of a school-based health center. This is a fairly new concept to schools. Ones closest to us include Auburn High School and South Beloit School District. Both of these clinics are run by Crusader Health. Essentially, it is a complete doctor's office located on school property that students can use with parental consent. The major benefits of a school-based health center include better access to care, especially for a free and reduced lunch population, who may have issues with transportation and finances. This would also, in theory, mean that we would be excluding less students from school due to noncompliance with physical exam and immunization requirements. Overall, I think it would improve the health of our students in general and hopefully lower the number of school days missed due to illness. We are currently exploring our options to see if it would be feasible for us to have one. One of the major barriers we're facing is that schools who have been able to justify the center and successfully gain a partnership with a clinic typically either have a much larger number of students or a higher free and reduced lunch population, or a combination of the two. As far as staffing, we've had 2 new nurses join our team. Casey Kane joined us at Highland. She has a background in clinic nursing and has been a great addition to our department. This month, Kayla Simpson will be joining us part-time at Highland. Kayla has a background in critical care nursing and is a parent in the district as well. We're very excited to have both of them. This year, we have been focusing on our staff wellness committee. The nurses send out weekly wellness tips to staff, and we have also been adding drawings for prizes that help give back to our faculty and staff. In January, we organized a staff volleyball tournament that was a fun way to get in a workout and build friendships with our coworkers. We hope we can encourage staff to make healthy choices in their lives. Recently, we began forming a student wellness committee at the high school. The idea of the committee is for students to promote health and wellness to each other. Most of the students who are on the committee plan on pursuing a career in the healthcare field. This also correlates with the high school's community service program, as the students can earn service hours through the committee. We've continued our partnership with the Snowman Valley Fire Station to provide CPR and AED training to our staff. This was made possible by a grant through the Meridian Education Foundation. Since the grant was obtained in 2016, it has funded 84 CPR certifications. Thank you to the Foundation for funding this vital program. We hosted our annual dental care clinic with Dr. Grinter and On-Site Dental this past month. 90 students in our district received dental care during the school day. I believe this is the 7th year we've had this clinic, and we look forward to hopefully having this service for years to come. So what do we do on a day-to-day basis? We see students who are sick or injured, give medications, and respond to any emergencies that come up, just to name a few things. We also see some students on a daily basis to oversee care of their chronic conditions like asthma or type 1 diabetes. As part of our department improvement plan, our goal was to decrease the number of students excluded from school due to noncompliance with physical and immunization requirements. In the previous school year, 13 students were excluded. which means they did not have the state-required physical and/or immunizations on file before the state deadline of October 15th, and they were not allowed to come to school until they turned them in. This requirement applies to students in grades pre-K, kindergarten, 6th grade, 9th grade, and 12th grade. Our goal for this year was to decrease that number by 20% by all of the action steps here that included providing more services, increasing the number of notifications to parents, and streamlining the communication between the nurses, principals, and superintendents. Pictured is the summary of our state report. This year, our number of students excluded decreased to 5. We worked very hard to meet all of the deadlines and keep up with the plan. As you can see, we far surpassed our improvement plan goal. This puts us at a 99.7% compliance rate, and this is something we're very proud of, and we'll keep striving for 100% compliance with 0 students excluded. Our data dashboard tracks 4 pieces of data. The first is the number of office visits to the nurse. Here are our numbers so far this year, and they're compared to last year. As you can see, we are seeing more students than we were last year. I suspect this may have something to do with this especially harsh flu season this year. The numbers on the chart are for the district as a whole, and they do not include students we see for scheduled visits for things like a daily medication or monitoring of diabetes. The next piece of data that we track is the percentage of students sent home from the number of office visits. Some of the main reasons that students are sent home include vomiting, fevers, etc. Parents may also decide to pick up their student for lesser reasons as well, which is up to their discretion. The percentages include all of these cases. As with the chart before, the gray line is this year's numbers, and the red line is last year's. This chart shows the number of students district-wide who have seen the nurse 5 or more times in a month. We decided to start tracking at the 5th visit mark to focus on those students who may be seeing the nurse too often, which means they are missing class time. There may be a medical cause, and in that case we usually encourage the parent to follow up with their physician to obtain a diagnosis and a plan of care. A lot of the time, these students may be facing social or emotional issues. In that case, we rely heavily on our school counselors so that we can work together as a team to support the students. The last piece of data from our department's dashboard is the number of Medicaid minutes billed for. If a student meets the criteria, the district can be reimbursed by Medicaid for nursing services that the student receives. The criteria is very specific. The student must have an IEP, have the need for a nursing service, and be eligible for Medicaid. This narrows our eligible student population significantly. Routine office visits for ailments are not eligible. Most of the minutes come from services such as administering medication. As you can see, we are not billing for as many minutes as we were last year. This is largely out of our control due to the eligibility requirements. Lastly is our budget. The Health Services Department draws from 2 lines, one for supplies and one for professional and technical services. $3,000 is budgeted for supplies and $2,500 is budgeted for services. As of February 1st, we have spent just over 60% of the supply budget and about 40% of the budget for services. We make it a point to provide cost-effective care, and we are on track to end this year under budget again. This completes the Health Services Report for the Board of Education for the 2017-2018 school year. Thank you for allowing me to lead this department. I'm proud to be part of a district that values school nurses.